Good afternoon. I'm Dor Dearborn, chairman of the sponsoring department today, the Department of Environmental Health Sciences at the School of Medicine. I'll welcome you with, I see that there's probably people from way beyond the School of Medicine, and that's what we had hoped would happen. So our speaker today, Dr. Karen Mulloy, comes to us from Denver. Of course, she is the director of the Denver Health Center for Occupational Safety and Health and an associate professor in the Colorado School of Public Health in the Department of Environmental and Occupational Health. Dr. Mulloy received her medical education in West Virginia School of Osteopathic Medicine, and then at Marshall University School of Medicine, she completed a combined residency program in both family medicine and together received a master's in community health. And there she had an emphasis on occupational and environmental health. She took that then to a residency at Kentucky School of Medicine in occupational environmental medicine. And so she is doubly board certified in family medicine and in occupational medicine. One of Dr. Mulloy's research interests has been on the establishment of surveillance systems for occupational illness and for toxic exposure and injury as part of environmental health programs. When she was at New Mexico, she was the principal investigator of a NIOSH, that's National Institute of Occupational Safety and Health, funded grant for the development of a statewide cooperative occupational health surveillance system. About 5.5 years ago, she moved to Colorado, where she has provided leadership in developing the same sort of program for the surveillance reports for Colorado and other states in the West. So Dr. Mulloy currently is co-investigator of NIOSH-funded Mountains and Plains Education and Research Center, and for 5 years was that region center's director of continuing education. She currently is the residency director for occupational environmental health at the Colorado School of Public Health. What brings her to us today is her extensive and ongoing experience with the occupational and public health aspects of oil and gas exploration in Colorado, but also in Wyoming and in the Dakotas. This is obviously a hot topic for us in Ohio. We are right on the bubble of having that industry pop up in a major way in the eastern third of the state. So in her presentation, we've asked her to not only look at what the concerns are, but also to give insights as to what we can do about some of those health aspects and those concerns. So, Dr. Mulloy. I did turn that on, didn't I?
I hope
yes.
so. He would have. No.
Yes.
Okay, good. Try to get set up here. Well, thank you very much for that kind introduction and for inviting me here today. And I wanted to say that I'm really going to talk a lot about the public health issues, and specifically as the lessons that we've learned out west, some good and some bad, and some policy gaps and some research gaps that I think that we kind of as a society need to be looking towards. So I want to acknowledge right off some colleagues of mine, Drs. Witter and Adgate at the Colorado School of Public Health, and I'll talk a lot about their health impact studies that they've done in the western slope of Colorado. Dr. Teresa Coons, who had with the Sacramento Research Institute out in Garfield County in Colorado, who had done an excellent study looking at public health issues out there that I think that'll be of interest to everybody. And my colleagues at NIOSH and OSHA for the occupational great slides that they had given me on worker health and safety, and we'll be talking about. And I think then when we talk about environmental health, we're talking about communities, but we're also talking about workers. And I think that's part of the dialogue that hasn't been happening a lot in many places. So let's begin a little bit. You know, the United States and global energy needs, along with political instability in the world, have driven up prices and specifically for fossil fuels, and have pushed the U.S. energy policy to increase domestic production of all types of energy, and really specifically in fossil fuels. And new technology, as you know, has made the fuels that were previously either unattainable or too expensive to get, now costly to be able to get out of the earth. The West has large reserves of extractable shale gas, but as you can see from the map from the U.S. Department of Energy, some of the largest reserves, such as the Appalachian natural gas play, are in the east and obviously affect Ohio. But shale gas is really only one of the areas that's being opened up to natural gas resources. There's others in coal beds and in the thing called tight sands and oil shales. So geologically, there's a lot of interest in development of these areas. Out west, the boom in the last decade has been in the production of unconventional gas specifically. This gives you a sense about where the natural gas production is. This data is from 2009, so there are definitely more wells in existence than there on the map at this point. There was an estimated 1.02 million onshore oil and natural gas wells, with about half of that being in natural gas development, so that's about 500,000 wells in the country. An estimated 11,400 new wells are fractured each year, and the EPA estimates that another 1,400 existing wells will be refractured to stimulate production or to produce some natural gas from a different production zone in the area. The total is estimated to increase by 17,000 to 35,000 natural gas wells per year between 2012 and 2035. So this is going to be a big boom across the country. As you can see, oil and gas operations are a complex and a process. They involve multiple steps from exploration to the final delivery of the product. Hydraulic fracturing, or fracking as everybody calls it, has allowed the development and expansion of this industry and made it possible to extract gas and oil where it's not been previously possible. But the fact is that fracking is really only one part of the operation. And what we've found is that even if there was an elimination of the various hazardous materials that many communities are worried about, many individuals are worried about, of the chemicals, as we'll talk about in the fracking operation, even if you eliminated those, you still have all the other parts of the operations that have a large impact on public health. And that's what we'll really talk a lot about today, and that's why my talk is really more about all of the operations, the impact that we've seen out west, and the things that we've learned. The other part of this, when we're talking about energy policy in this country and public health, is that the other issue to keep in mind is that natural gas is a cleaner burning fossil fuel than, let's say, coal. And in fact, when my colleagues at the Department of Environmental and Occupational Health at National Jewish, premier institute for respiratory diseases in this country in Denver, looked at changing the coal-fired power plants that Denver has to gas, their analysis was that there would be less air pollution with natural gas, and that would have effects and benefits for public health by reducing air pollution within Denver. So that's some parts of the conundrum of this topic that we oftentimes talk about when we talk about public health. And but the problem is that the extraction of the natural gas isn't necessarily a cleaner operation, and that's part of what we'll talk about. So I want to talk a little bit about, we'll be spending a lot of time talk about different parts of Colorado and just get you a little bit figuring out about what's what. The right part of the map, this is the Eastern Plains, and looks a lot like Kansas or Nebraska. It's flat and full of farms and ranches. This is the Rocky Mountain region, And the Denver area down to Colorado Springs is called what we call the Front Range. So if I refer to the Front Range, that's the area. Weld County is this huge area up here, and we'll look at that in just a moment. On the western side of the state, on the left-hand side of the map, we'll be talking about a lot about Garfield County, where a lot of studies have been done by the Colorado School of Public Health on issues of public health. But we'll talk a little bit about Mesa County and Delta County and Montrose. This area is referred to as the Western Slope. It's the western slope of the Rocky Mountains. So it gets you a little bit introduced to that. So this is from a week ago, the gas wells that are in Colorado as of now. Green are the permitted wells, and the blue are the pending permits. So you can see the areas in Weld County is a huge area, and some on the eastern plains, and then in this western slope region is the other part that we've seen and looked at some public health issues. This is a satellite view of the Roan Plateau. This is the western slope. This is Glenwood Springs, which is in Garfield County, and the western slope goes down to Grand Junction in Mesa County. And we'll talk specifically a bit about this Roan Plateau region and specifically about Garfield County. This is a drilling rig that stands at the foothills of the Roan Plateau. And this is usually the picture that is often presented to make the case that there's very little impact on the landscape. But actually, this is what is actually happening. The conversion of wilderness areas, sparsely populated regions, ranch lands, farming lands, and even some populated areas is now an industrial landscape of roads, drill pads, power lines, compressor stations, reserve pits, evaporation pits, injection wells, and other infrastructure. And as you can see, this big operation that we've had in the last number of years goes from the Colorado River here, then to the base of the Roan Plateau. The Roan Plateau, as you can see, is an incredible wilderness region, and it was also the site of possible drilling. And in 2008, the U.S. Bureau of Land Management developed a plan for oil and gas development and sold leases to companies for the development of operations. But there has been a great deal of fight about that, as you can imagine. What we've found is at the Colorado School of Public Health is that the discussion on the environmental side of the oil and gas exploration and production is in terms oftentimes, and not badly so, but of the loss of pristine regions and loss of wildlife habitat. And that obviously is a concern, but often the issues of public health have not been addressed very well. It's been interesting. In June of this year, 2012, the federal court ruled that the Bureau of Land Management didn't follow protocol when they approved a plan for allowing the oil and gas drilling and development in this Roan Plateau region. The U.S. District Judge Marcia Krieger set aside the plan and ordered the agency to take another look at it and do some reanalysis. She ruled that the BLM failed to sufficiently address cumulative effects of drilling on air quality over time, with drilling on both public and private lands and in the area, and failed to take into consideration the potential for the ozone effects, which we'll talk more about in just a little bit. So this is a typical well site, and the derrick and dog house, and these are the mud pits and the reserve pits, and we'll talk a little bit about that later when we talk about it, especially worker exposure. This is a simple schematic on the right-hand side, the conventional gas wells, where a vertical drilling into the gas reservoir. And then this unconventional, what we call unconventional gas well operation. So fracking involves the injection underground of millions of gallons of water under high pressure mixed with the sand and chemicals, and goes deep into the rock and releases the gas trapped in there. And for any geologists or mining engineers, I know it's a very simplistic explanation, but I just wanted to get through that fairly fast. And then basically, releases the gas into this in the shale or the coal bed methane, and comes back up again. And every fracturing zone within a well may be prepared individually depending on the results of the geologic test. So it varies from well to well and from play to play, or geologic area to geologic area. So one of the things we've thought about in the West is that unconventional gas operations use diesel-powered heavy equipment that runs continuously through the operation. Water is the driving fluid in the process. In the West, the current concerns are on our scarce and limited water resources and the amount of water that's needed to complete these operations. For instance, in New Mexico, the average rainfall in New Mexico is 7 inches a year. And I know you guys get them more than that, like in an hour sometimes, and that's in a good year. We lived for 13 years in New Mexico, and many times we had a great deal less than that. And so thinking about overall of society's use of water for agriculture, for other human needs, thinking about those resources is one of the areas in the West that have struck people as something that needs to be talked about. So depending on the particular geologic formation, it may take up to a few million gallons of water to do a fracking job. One well can be fracked 10 or more times, and there can be up to 28 wells on one well pad. So this is an example of the hydraulic fracturing fluid combination that's specific for shale well. I know the oil and gas industry points out that the fracking involves mostly water and sand, which is true, 90 or to 95% of water and about 5% sand. And the chemicals are a very small amount of that, less than 0.5%, maybe sometimes up to 2%. It's a mixture of chemicals for various regions. Like the biocides are used to decrease the amount of bacteria within the well so that you don't have hydrogen sulfide contaminating the well and causing problems of like worker exposure hydrogen sulfide. But the interesting part is that if you're using like 4 million gallons of water for the fracking operation, that percent would be about 80 to 330 tons of chemicals. So it's not an insignificant amount of chemicals, even though it's a small percent of the overall amount. So what's in the 0.43%? So this is a typical Western percentage breakdown of an operation in the area. And we know some of the chemicals do have health risks, such as the ethylene glycol. When it's a liquid and it's agitated or sprayed, it can cause respiratory irritation. Ingestion is probably the biggest public health problem that we worry about, can lead to systemic toxicity if ingested. And things like ammonium persulfate with exposure is known to be an asthmagen or cause asthma, as does the glutaraldehyde. And this is the area with these chemicals where we've really looked at a lot about worker exposures because they're right there. And we found that less of a problem, that it's oftentimes an enclosed system, but there are other big issues for the workers that we've seen more than these specific chemicals. But what's obviously been of concern to communities is does it end up in either groundwater or other contamination? So in 2008, the Colorado School of Public Health published a paper, a white paper, and noted that there were no studies addressing the health effects of fracturing fluids, and this was a major public health gap. And so felt that this was an area that science needed to be really looking at when looking at overall public health. Since the white paper, there have been a few studies on potential water pollution. The Garfield County oil and gas studies and EPA studies have demonstrated that natural gas development production can release contaminants into domestic water supplies and compromise water quality. The individual circumstances that influence potential contamination of water really vary. Our experiences in Garfield County, it's mostly been accidents and malfunctions during the operations that have been most common causes of the water contamination. In other places in the country, there have been other reasons for that. And so that's one, every area needs to kind of look at what are those areas where there have been problems, and then how do you then address those problems. This is a photo of produced water pit, or the reserved pit that we saw the picture of, and during what's called a flowback operation. When the gas comes back to the surface, some of the water comes back along with underground brine that exists naturally, deep, because these wells are very, very deep. Underground brine is several times saltier than seawater, and also has, obviously, the fracking chemicals come back with it. It's estimated 30 to 70% of the fracking fluid will resurface. It also brings back volatile organic compounds, or what we call VOCs, and that are naturally present in underground oil and gas deposits. And those we've measured, like in Garfield County, have been what we call, generally when we're talking about this for workers, is the BTEXs, so benzene, toluene, ethylbenzene, and xylene. They definitely all have health effects, and that's why we try to protect workers from those. Benzene is the one of most concern because it is a carcinogen. So during those operations, you can smell the VOCs in these areas. Workers and researchers at NIOSH and folks from OSHA, have noted that and tried to figure out how to protect workers in those areas. The other thing that comes back is also barium, which is found in underground ore deposits at various levels, and naturally occurring radioactive substances, which are also deep within the ore substances. In the Barnett shale field in Texas and deposits in New Mexico and Oklahoma, the dominant disposal method for drilling wastewater is to send it back down into the ground via injection wells. Now, as you can see, injection wells are highly regulated by the EPA under the Safe Drinking Water Act. So that method is regulated when it comes to looking at protection of the environment and thinking about public health. The Energy Policy Act of 2005 exempted wells which are hydrofracked from being reclassified as injection wells, which would place them then under the federal regulation of injection wells. And the issues of groundwater contamination have brought that question back up about the exemption, and is that appropriate under that? Is that exemption appropriate or not when you're thinking about protecting the environment and protecting public health? Two studies released in 2009, one by the U.S. Department of Energy and the other released by the Groundwater Protection Council, address fracturing safety concerns, including contamination of groundwater and risk to air quality and migration of gases and chemicals, and the potential mishandling of waste, which is what the produced water is waste. The interesting part, in that kind of echoed our study at the Colorado School of Public Health, was that the potential costs associated with possible environmental cleanup processes, loss of land value, and specifically on human and animal health concerns were undetermined at that point in those studies in 2008. So I think people have heard about this, about the Pavilion area in Wyoming, and the EPA study that had done in the recent release of the U.S. Geological Survey study. But in 2008, the U.S. EPA initiated a groundwater investigation in this small town of Wyoming in response to concerns from citizens about domestic well contamination related to hydraulic fracturing nearby. The agency conducted 4 sampling events and from about 2009 to 2010, and they collected it from domestic wells and municipal wells in the town of Pavilion. The detection of methane and dissolved hydrocarbons in several domestic wells prompted another second collection of a round of samples, because that was of concern. And then they added some groundwater samples from domestic and stock wells. So looking, because this is a big ranching area, as you can imagine, and groundwater samples from some shallow wells. And then they ended up digging some very deep monitoring wells to look at how the migration of these elevated levels of either methane or the diesel range organics were going. So in a 2010 study report, they interpreted the data and indicated that the groundwater may contain chemicals associated with gas production practices. And so in 2012, there just would have been a release again from these deep monitoring wells near the pavilion area that the U.S. Geological Survey, and they again established problems with petroleum-based pollutants from at least one of the monitoring wells. So people's and citizens' concerns about that, have shown to be real. When we talk about this produced water, in some arid states, wastewater is treated in evaporation pits. So the West is very dry. It's a very good way of doing it. So basically, the produced water and all the things that come back up with it are essentially baked off by the sun, leaving this salty sludge that is disposed of in injection wells. So then that would be monitored by the EPA. But oftentimes the salty sludge ends up being put in landfills, which may or may not be under regulations. In addition, the drilling or reserve pits are found on most well pads, and they can continue up to the life of the well, and that can be 20 or 30 years. So out west, it's a common practice for some of these reserve pits to haul this produced water with the barium and the radium and the salty sludge and the fracking chemicals and the brine in water trucks to large central evaporation pits. So often some of the operations in the western part of Colorado, they haul off all of that produced water over to Utah and put into large evaporation pits over there. So there's some concern about those issues with neighboring states. The problem is that all of that's in the produced water, and that is then now this kind of salty sludge has many chemicals that are considered hazardous waste by the Superfund. The long term, but Comprehensive Environmental Response Compensation Liability Act, or what everybody calls CERCLA. And upon a closure, every pit has the possibility or potential to become a Superfund site because of those chemicals. In some areas, the produced water is only partially treated by waste treatment plants. I think that's been a problem more back east than in the west. We tend to have more of the evaporation pits. The treatment plants can remove some of the things like the barium and the radium fairly easily, but what's not easily or it's very costly to remove is the amount of salt from the brine that's in this produced water because it comes from so deep down. And the problem is that those salts, so if you don't remove all of that and then you've put it through the treatment plant, it did remove the barium, did remove the radium, maybe some of the chemicals, but now you've got this very salty water that's going into the streams. It triggers other problems. And one of those is known as the trihalomethanes. And they're not found in drilling wastewater, but the wastewater contains bromide and they react with the chloride. So for the person that's downstream, they're pulling the water from downstream. It has a lot of the bromide in it. They put chloride in it to treat it for people to drink, but that ends up creating these trihalomethanes. So it's been a problem then on the downstream areas that a number of communities have failed the EPA regulations on trihalomethanes because of this problem with the trihalomethanes. And it's been in Pennsylvania. We've had some problems similar to that in Silt, Colorado. The EPA say that the health effects, what we worry about, is elevated levels of trihalomethanes for many years. So this is a chronic low-level exposures over many years. People have increased risk for cancers and develop liver, kidney, or central nervous system diseases. And so oftentimes, you know, when we think about the environmental exposures, it's that low-level exposure over many years is the problem and doesn't sometimes be seen right away. The EPA is currently working on a national pretreatment standard for waste headed to municipal sewage treatment plants or private treatment plants after finding many of them are not treating the produced water effectively. So that's good on the horizon. That's a good policy move by the EPA to set in some new standards. So what's known about the other things in produced water? So barium in drinking water, again, people who ingest it over many years, it's been linked to hypertension. And then the radium, you know, radium consists naturally. In fact, there was a recent Environmental Health Perspectives article about radium in water. And it's, you know, it's everywhere, it's naturally occurring, but it's higher in some areas. So out west, especially in the Four Corners region, so that's where Colorado, Utah, Arizona, and New Mexico all come together on the Navajo Nation, we have huge amounts of uranium ore deposits in the area. So the radioactive waste coming from those areas is fairly high. And what happens is that from in the form of produced water or drilling mud or sludge or slimes or in the evaporation pits, then we see higher levels of radium. And it can concentrate on as mineral scales on the pipes and in the storage tanks of the area. So mostly it's radium-226, which is an alpha emitter with some accompanying gamma radiation. It has a half-life of about 1,600 years. Radium-228 is principally a beta emitter and has a much shorter half-life, about 5.5 years, and radon gas. Now, so for the radiation exposure, the radium exposure, the people most likely to be exposed are actually workers at the site. The problem is with radon gas coming up, and which leads to, during the drilling operations, in some of the areas where you might have higher radon levels, it has to be monitored and looked at, and because it can end up causing some problems with lung cancer by breathing radon gas. And then, you know, there also is some of the thoughts about some of the, when you get then into these pits that now have all of this dried sludge, which has a fairly high radium content to it, and the wind blows, and now the stuff with all of these salts and radium and barium are blowing around. If it's in areas where there's some population, there's some thoughts about it, but there really has not been any good research done on this at all. So let's talk a little bit about the VOCs. There are tons of volatile organic compounds that get produced during these operations. Ambient air studies in Garfield County noted that natural gas development activities emit several hazardous air pollutions, including the BTEXs, the volatile organic compounds that I mentioned before. There was a 2008 Garfield County air toxic study which monitored 4 sites undergoing drilling activities and well completion activities. And they found actually, which actually we were a bit surprised about, but it was good to learn, that well completion activities actually emitted larger volumes of VOCs than drilling activities did. And that the high concentration of the VOCs, and specifically thinking about the benzene and its cancer risks, were of concern as many of the well pads were close. We're not in some of the isolated regions that you saw the pictures of, but we're actually in close populated areas. The public health concerns about VOCs are that they mix with nitrogen oxides from the exhaust of the diesel-driven mobile and stationary equipment in these operations, and they produce ground-level ozone. Gas field produced ozone has created serious air pollution problems out west, similar to the urban areas. So the Colorado School of Public Health had done a recent health impact study in Garfield County looking at risks, health risks with air emissions in the natural gas production, and using the EPA guidance to estimate chronic and subchronic non-cancerous indices, and looking at the hydrocarbons. So, and kind of looking at people who live closer to the wells and more from the wells. So obviously, for the women thinking about the VOCs, the residents living within less than a half a mile had greater risk for health effects than the residents living greater than a half a mile away. And that some of the risk management thoughts that they did was looking at the emissions during the well completions, and so looking at engineering controls of reducing the VOC emissions was what was recommended. So thinking a little bit about the ozone. Now, this is an aerial photograph showing the vast network of roads and well pads that make up a portion of the Jonah 2 National Gas Field. It's located in Wyoming's upper Green River Basin. It's about 35 miles south of the town of Pinedale in Sublette County. And so you can see the Jonah 2 field graphically illustrates the significant impact currently occurring in America's public lands from new oil and gas operations. And despite the most recent technology, the federal lands really have been converted into an industrial landscape, as you can see. Now, the Upper Green River Basin is home of the longest terrestrial wildlife migration corridor in the lower 48 states, and so is of a concern ecologically. So let's look at the case of Sublette County. It's located in western Wyoming. It's about 5,000 square miles. It's a big county and has a population of about 10,000, so a small amount of people who live there. It's typical of the West. And the drilling of new wells and flares and routine maintenance and gas field equipment release VOCs and nitrogen oxides, increase ground level ozone areas. So the interesting part for the West is, unlike other parts of the country where the ozone areas, ozone levels increase during the summer months, ours increase in like Wyoming and Colorado and Utah and New Mexico in the winter, because it's a combination of this gas industry emissions, snow-covered ground, bright sun. We have 360 days of sunshine a year. And the temperature inversions during the winter that cause the ozone. So in March of 2011, the ozone levels got as high in Sublette County at 124 parts per billion, which is 2/3 above the level of the EPA's maximum level of 75 parts per billion, and above the worst day in Los Angeles the whole entire previous year, who only had gotten to 114 parts per billion. So you kind of think always of Los Angeles, and then you think of this very rural county with very few people and very few cars, but with these other operations going on. So the Colorado Department of Public Health and the Environment 2007 emission inventory for Garfield County indicated that the natural gas development industry was the primary contributor of the nitrous oxides emissions, as well as the primary non-biogenic contributor of VOCs. And the Garfield County 2009 Air Quality Monitoring Summary Report attributes the natural gas activities as the largest contributing source of ozone precursors for Garfield County. And Garfield County is also a very rural area and has had tremendous problems with increase in ozone and surpassing the EPA standards. And we've seen similar problems in Weld County. Remember on the Front Range, so in the top part of the state and the Front Range, the EPA has looked at the issues, and actually NOAA out in Boulder, Colorado, has done some studies looking at the emissions from the Weld County operations and increasing ozone, ground ozone levels for the Front Range, so including Denver. We've had elevated ozone in New Mexico and in Utah and very rural counties related to the natural gas development. And so we consider this as probably one of the biggest public health issues that, as I said before, if you got rid of all the fracking chemicals and had really kind of safe stuff, you still had all of these diesel engines running all the time, producing the problems, and then the VOCs escaping out of the wells. And we know that ozone from the air pollution studies is a huge problem. And in low-level exposures cause damage to small airways, reduce lung function, is an inflammatory response, chronic effects. There was a really very interesting study by the National Institute, it was funded by the National Institute for Environmental Health Sciences, showed that children who play 3 or more sports outdoors in areas with high ozone concentrations were more than 3 times likely to develop asthma as children who did not play outdoor sports. So now we have this public health issue of childhood obesity and trying to get kids outdoors playing sports, but then we have the high ozone areas, and so they have to play indoors, and so it's, and then they're just playing on their video games. So it's, you know, again, one of those issues that we have to kind of have a good public talk about our policies. The good news is actually, though, that the EPA announced in April of 2012 new and updated air pollution regulations to reduce the emissions of methane and VOCs. They're called green completions, and actually Wyoming and Colorado have led the way. We already have some laws that establish that wells have to have these green completion, or what's known as reduced emission completion. So it's a way of capturing all of those VOCs, the escaped methane, and to reduce the amount that's being released during these, either the drilling of the wells or the completion of the wells, or the production, the constant production of the wells. So the EPA estimates that the green completion process will annually cut about 95% of the VOCs emitted from newly fracked and refracked wells. So it goes into effect on January of 2015, so that's the good news. But it only then will go for new fracked wells or refracked wells, but the wells that are in production at this point will not be under this law. So that's an area of policy that we need to be thinking about. There will be a transition period to ensure that green completion equipment is available to all of the producers. And as you can see from this environmental health practice study, that looking down here at who's producing the most VOCs in this country at this point, as you can see, it's oil and gas production. But during the transition period, the companies must reduce emissions through combustion devices. So that's flares, so that's burning off the VOCs or the escaped methane. Well, the problem always with flares is that they are their own source of pollution, air pollution, and because the incomplete combustion of fossil fuels causes problems with carbon monoxide and nitrogen oxides, and particulate matter, the small particulate matter, the 2.5, which we know from lots of air pollution studies is a problem. So that's another area that we probably need to be thinking about. And I know everybody's seen this picture, very famous from YouTube and from the movies, about being able to light your water at your sink. But it's, I think probably the most interesting part about this was that there's a recent study from Duke University published in the Proceedings of the National Academy of Sciences that there was methane contamination near active gas wells that exceeded the EPA action. The problem is that there have not been any studies looking at what is that low level of exposure to methane, either in people's houses, what does that do for health? There's really nothing there in the literature on that, and there's really no regulations. Over the life of a gas well, you can have up to 5 to 7%, which are fugitive gases, and basically the EPA has indicated that methane is the largest contributor to the increase in greenhouse gases at this point. So let's talk a little bit about occupational health and safety, and this is the area that I've done a fair amount of study in myself. And as you can see, the number of looking at from 2003 to 2008, the rate of fatal injuries from the BLS, the Bureau of Labor Statistics, the Census of Fatal Occupational Injuries, that the fatality rate is huge. When you think of the fatality rate for all workers in the United States in those years was about 3.9 per 100,000 workers. And you've got the industry, the oil and gas extraction industry, at 10 times that. Traditionally, the industries that have been the sectors that we've worried about and have tried to intervene the most for fatalities have been in construction, mining, and agriculture. But with the rapid expansion of the oil and gas industry with long work hours, inadequate training, lack of safety. Out west, we see many migratory workers who come up to pick crops, stay, start to work in the oil fields. They don't speak English. The safety messages are in English. They've only worked agriculture. Now all of a sudden they're working in a highly industrialized system, and that's where oftentimes we see a lot of the injury rates coming from. And as you can see, when, again, this study looking at what was the biggest problem, highway crashes are the biggest. West, unfortunately, in places like Wyoming, there is not a primary seatbelt law. They're kind of, we keep putting it before the legislature, and it keeps getting defeated. But you know, this was one of the areas that we thought that would be helpful to have some public health input. Struck by is the other largest area. Explosions, and then it's caught or compressed by or falling off the derricks into a lower level and things. So as you can see, there's lots of areas of being able to do some intervention. And you know, explosions, you know, this is always potential for flash, and workers are required to wear flame-resistant clothing. The last worker, gas worker in Colorado, 60-year-old, killed in an explosion. And this has been an area that OSHA has been doing a lot of inspections on and looking at ways of reducing that risk for the explosions at the well site. The Mountain and Plains Education and Research Center and the NIOSH Western States Office conducted a project with the state of Wyoming and looked at the occupational health indicators and specifically at fatalities. And as you can see, from the years of 2001 to 2005, we were Wyoming was 3 to 4 times higher than the national average in fatality rates. When we drill down into it, again, over half were transportation, and when we drill down into that, the industry where the transportation was in the oil and gas industries. Many of these wells are in very rural areas, very poor driving conditions. If you've ever been out west or been out in Wyoming in the middle of winter, those blizzards can come up suddenly. And the other thing is that people are working long hours. They're then working in very isolated areas. They're working 12-hour shifts, and then they're maybe driving 3 or 4 hours to a place to stay or to go home. So the issues about fatigue on the road is one other area. You know, but the good news is that there can be interventions that work. And in Wyoming, when we presented this to the state legislatures and to the public health officials, they had already been getting some help from NIOSH in looking at how to reduce their occupational health fatalities. And so by 2007, they were #1 in the nation. It used to be Alaska. Alaska had some actual interventions that worked, and they reduced their fatality rates. Wyoming became then #1. And the governor at the time, along with actually a combined committee of public health officials and NIOSH and us at the Mountain and Plains Education Center, legislatures, industry, all worked at some interventions in some of the big ones on transportation and being struck by within those sites, and also OSHA was involved with this. And you can see in a couple of years they went down from #1 to #4. So there are ways of doing that. There are ways of looking at interventions and education and safety measures. One of the areas that they found was that the big companies like Encana that are out west, you know, have health and safety officials that work for them and work with the workers on health and safety issues, but very small mom and pop operations don't have those. And so oftentimes the bigger companies were helping some smaller operations in looking at their safety issues and ways to reduce injury and fatality rates. So this is the other area that we've looked at, oil mists and the VOCs within the drilling operation during completion operations. One of the problems we found is that the oil and gas drilling, production, and servicing operations are exempt from the benzene standard under OSHA. So OSHA has a benzene standard which protects workers from exposure to benzene, which is a carcinogen causing aplastic anemia and leukemia. And so OSHA has been looking at using the what's called the general duty clause to address those exposures to VOCs for the workers and figuring out ways of reducing those exposures. And NIOSH has been working with the industry to assess exposures and look at prevention strategies. So hydrogen sulfide is one of those areas that of concern for workers. It's a contaminant in gas wells, and as you know, it's both, hydrogen sulfide is both, it's a gas that's both an irritant and a chemical asphyxiant, can cause death with high exposures. And one of the NIOSH fellows shared this with me as a hard hat for one of the oil and gas workers. No limit, I don't think means for no limit for the hydrogen sulfide. I think that's a rap record group or something. But anyway, so they put lots of things on your hats, hard hat guys do. Anyway, here's a hydrogen gas monitor that they have to wear all the time, and that will alert them to the fact that the hydrogen sulfide is going up and to then evacuate out of the area. So the NIOSH guy said, well, can you tell me, what is it that you really do, and how do you read your monitor and things? And he says, when it lights up, this is what I do, and it just says, he wrote on there, run. He says, so it lights up, I don't care what the level is, I just run. So there are ways of doing some teaching in these areas that are really important. But probably this is the biggest thing that has been found out. NIOSH had been worried about the VOCs and worried about the fracking chemicals for workers, but when they went out and did sampling, they actually found out that the silica exposure was the really big problem. Because remember, 5% has to be sand. And the fracking sand is about 99% silica, which is a high percent silica for the sand. They, in cooperation in this past year and a half, cooperation with the oil and gas industry, NIOSH partnered with them, and they did 116 full shift air samples in 11 hydraulic fracking sites in 5 states, so from east to west, so across the country, just to see is it different in the east, is it different in the west. And they to determine the level of silica exposure for the workers. And basically of the 116 samples collected, 47 showed silica exposures greater than the calculated OSHA PEL, that's a permissible exposure levels for workers. So after that, there's a problem that you have to wear respirators, because there's a problem with health effects. 79% showed silica exposures greater than the NIOSH REL, which is the recommended exposure level, which is a little bit lower than the OSHA level for greater worker protection. 9% of all samples showed silica exposures 10 times more than the OSHA PEL, with one sample 100 times more than the PEL. And so when you get to exposures for workers at 100 times the exposure rates for silica, that's when you get into that not a slow progressive chronic lung disease, which is what silicosis is from silica exposure, but you get into accelerated silicosis where you get a rapid progressive silica disease within 5 years of exposure instead of maybe 20 years of exposure and things. But basically, as you can see, here's this guy going down into one of the areas where the sand is, and that's been a problem. We've seen deaths there. People going down into the trucks where the sand is. It gets crusted over. They're breaking up the crust, and then all of a sudden the crust breaks through. They're engulfed into the sand, and before anybody can get them out, they're asphyxiated. And that's been a couple of deaths in Colorado from that. And here's a worker here, if you can see, and the sand is spraying out of the sides, and there's a big exposure there. And as you can see, it's this huge exposure to silica with all of these workers. And so the big companies have been working with NIOSH to look at engineering controls of this, and they've been able to do some of that to reduce that. But otherwise, workers are going to have to wear respirators and to be monitored for silica. Besides silicosis, silica exposure, as you know, has problems with, it's also a carcinogen for lung cancer, and has been linked with other diseases. People who have silicosis are more likely to get tuberculosis on top of it. They can get chronic obstructive lung disease. It causes kidney disease and autoimmune diseases. So silica has been around a long time, and we've known the issues, but this is the area that they were actually kind of surprised about the worker effects. Lead exposure, a simple story. Some companies were using pipe dope that had lead in it. Kids were showing up in Weld County, Colorado, with elevated blood lead levels because Dad was taking clothes home with lead dust on it and from the pipe dope, and hugging the kids and washing their clothes at home. So an educational campaign for the companies to be looking at that and substituting non-leaded pipe dope for the leaded pipe dope that they had. Similar problems had happened in Oklahoma. So this is kind of the last one, and you think about all of these machines. Also is the other part about it is the amount of noise that happens with noise-induced hearing loss. So those workers have to wear hearing protection, but a lot who do not. And we know over time, then workers get a huge amount of hearing loss because of that. The exhaust produces this diesel particulate, and we've done a lot of studies looking at underground miners with diesel engines and in other industries with diesel particulate exposure, and also some of that comes out of air pollution studies. And diesel particulate matter is in the form of this individual particles of chain aggregates, mostly in about 100 nanometer size. And so the exposures for thinking about air pollution or airborne exposures is in ultrafine particles. And so some of the best research has been done on ultrafine particles, again, is on air pollution studies in major cities. And we know that the problems with the ultrafine particles lead to problems with cardiovascular disease, cardiopulmonary disease, and lung cancer. So, and this is the last study I'll kind of talk about, and this is the one that nobody ever wants to talk about. And this is probably, to me, the most interesting part of public health that people don't have, they really need to be thinking about and addressing these issues. This is, I talked to colleagues up in North Dakota, and this is a huge problem that they see at this point, and we've already gone kind of through this in Colorado. So you have, in a very rural area, you have very little housing, not much infrastructure at all, if you've ever been out west in the very rural, and some of them are called frontier areas. And so when you bring thousands of workers into a rural county, you then don't have enough places to put them up. And so you bring in these portable places, and they're called man camps. So now you have thousands of men, workers, and living in these man camps, and all of these trucks coming in on these very rural roads, and if anybody brings their family, there are not enough schools or not enough educational services, and so the areas, of all of industrializing a very unindustrialized area, happens very fast. And so there was a great study done by the Sacramento Research Institute and Mesa State College with the help of communities in Garfield County, and they studied a study of the 4 counties, it compared 4 counties in that western slope region. Garfield, Mesa, Montrose, and Delta counties. And all of the 4 counties had very similar social and political cultures. Population demographics were very the same. And the citizens were concerned about these long-term health effects, but the oil and gas boom had been very short, but they were thinking about, oh my gosh, we're going to have all these cancers or asthma problems or birth defects, and so they looked at all of that, but they looked at all of the public health issues in those 4 counties. And but the Garfield County had the biggest impact for the oil and gas explosion. So when they looked at from 2000 to about 2007, there was kind of a big boom in the early 2000s, and it kind of then dropped off again, and then now has kind of gone up again. Because remember, kind of in the mid 2000s or 2006-07, there was a drop in oil and gas prices, and so there was not the big explosion, and it's kind of come back up again. So what they found is that they didn't find any increase in cancers, because really cancers take 20 or 30 years to develop, as we know, and they didn't find any increase in birth defects. But what did they find, and similar issues about the man camps in Garfield County, is that they found the rate of reported cases of chlamydia and gonorrhea in Garfield and Mesa counties had steadily increased from 2003 to 2007. And that Garfield County, and this is a very rural county, had the highest rate of reported HIV cases among the 4 counties for the year of 2000, 2001, 2003, and 2005, both men and women, and the rates were higher than the state rates, including Denver. And this is what they're now seeing in South Dakota, is these issues of industrialization and then problems of all these workers and problems with what North Dakota has been worried about is drug use, alcohol use, and sexually transmitted diseases. And a lot of it is one of those areas that these county health departments are kind of then just are overwhelmed. They don't have the infrastructure really help to take care of everybody. So it's been very, very interesting. And it's that sudden change in population numbers and in industrializing a very non-industrialized area that has led to that. So that's the conclusion of our experiences out west, some solutions that have happened, some big gaps in policy and big gaps in research, which I think that public health people need to still do. And we'll certainly have any questions. And this is one of the parts of Rome Plateau that's so beautiful that everybody's trying to protect. So any questions at all?
Formaldehyde exposures in the trailers with the insulation. Did anyone look at that?
I'm not sure they had. That certainly is an issue. Obviously they see that after Katrina and after every time they bring in. Yeah. And I'm not sure that people had looked at that. I don't think that they had and stuff. For the Sacramento Research Institute study, they really looked at the community. They didn't do a specific worker study. Because you think about that, these are the workers that are living in that area, but actually hadn't done a worker study. And when NIOSH hasn't looked at the health effects of living conditions, they really looked at the work conditions. But that is a great area. And what I think that my colleagues in North Dakota now are saying is that people work very long hours. And then maybe drive on the weekend back to where they come from, maybe in Texas. And that's where some of the issues on road accidents have been happening and things where people are very tired, or people taking drugs to try to stay awake and to do those long hours and things, or to try to, what do you do in the middle of nowhere, North Dakota, but drink or whatever. So, but I think that's a great issue. And, for people that, there's issues about formaldehyde, it's the off-gassing of the particle board that's made with formaldehyde in enclosed spaces that we've seen problems with, especially with kids and asthma from that. But that was a great question, so yeah. So that.
You addressed, the western areas where it's very rural. In Ohio, the way the law is written in Ohio, gas wells can be as close to a home as 150 feet. And I'm wondering, what are the long-term effects of residents of, in that close proximity?
Right, yeah. I kind of showed the pictures of the things in the, because it's so, like I said, it's like, it kind of show you one well, but when you look at it from the air, it's, it's an industrialized landscape. But there, in the West too, there are many wells that are close, and that was the Garfield County study looking at if you're within less than a half a mile of the oil well versus the greater than a half a mile, and the issues of the levels of the VOCs closer, whereas the VOCs mixed with nitrous oxide creating ozone, those can spread up to 200 miles beyond all of those oil well or the gas well areas. And but the people that live in the close, that was the area of most concern, that they said that they needed to have more regulation on decreasing the amount of VOCs that escape out of those wells because of things like the benzene and stuff with people living so close to those wells. There is concern about that. It's concern about the VOCs overall causing the ozone, and then secondary with people who live much closer to the wells, the VOC exposure to those areas.
Did they look at specific conditions?
So they looked at the, remember we talked about, they looked at the gas completion part produced more VOCs than the actual drilling part did. So there was less escape of that than they did. When you saw that picture of that produced water, the reserve pit, coming back. My colleagues at OSHA say, those, you can smell the VOCs in those areas and things. It's a fairly concentrated area. So if you have all of that fairly close to where people live, that's of the area of concern. And was one area that that the Colorado School of Public Health needed to have more, more looking at long-term health effects on that.
I was curious,
Yeah.
did they look at specific conditions? I've heard of things like skin conditions, respiratory conditions, neurologic. Did they look at those specifically?
The health impact study was done to look at risk, which is what the health impact study was, and they recommended then going that next step, which would then look at a prospective study of people over time, and that's not been funded yet. We had a bit of change of politicians in Garfield County, and all of a sudden they were not interested in doing the second study. So, but the school is still on that path of then looking at a prospective study and looking at specific conditions, short-term health effects, obviously, then and long-term health effects. So, yeah, so that's good. So that, yes, and then.
Does Colorado require disclosure of the exact chemicals that are put down in the ground?
So, in 2008, I did a conference with the U.S. Geologic Society on the Western Slope, and it was very interesting at that point. The people from Ankana were, wanting people to be open about that. The people who actually did the fracking part, which is Halliburton, no, this is all top secret stuff, gives us an edge, to our competitors and things. So that, and I think obviously back east has been a concern. There now is a much more easier disclosure. There's that frac focus of the website that you can look at specific wells and find out what the chemicals are and things. I think there's still problems sometimes that there is some trade secret to some of the chemicals. I mean, as an occupational medicine physician, we run across that all the time. I have a worker come in, they're working at this plant, they got sprayed by this substance, and the MSDS sheet only tells me some of it, and some of it is trade secret, and I have to call up the company and find out what it is. So there has been, in the last several years, and certainly within the last year, a much more openness about what's in the chemicals. As you see, I had a list of a well that was typical of the Western Shale area and what the percents are and which of the chemicals there were and things. The problem is, it sounds like we have the same law that you have. Dr. Dearborn had told me about was that if there was a secret part of that, and I was like an ER doc and I was concerned about someone having exposures, or if I was a physician, I can call up and I can get it, but then I can't tell neighbors or anybody else about that particular chemical that might be a health risk. As a public health person, it's against all public health rules. It just is, we have to be able to say the things in public health about, if there are real concerns, there definitely has been an opening, a little bit more transparency than has in the past. So. So that, yeah, and you had a question?
Along the lines of communication, I live in a rural county just east of here, Geauga County, and moved there a little over 2 years ago. I didn't know anything about any of this stuff, but I've been following it closely since then because I have a couple of young daughters. And just trying to get the information out to other people. You go to these leasing meetings, and they're up to $5,500 an acre now to get people, and there's no, I haven't seen any kind of outlet for critical information except for kind of ragtag community organizing. Does Colorado, have they had any more success in communicating kind of in more balance, maybe from the government or from better organized? Because you won't get anything from the ODNR here, or you won't get anything critical. You won't hear any of these, you won't see citations of any of these studies.
Right.
There, as far as I've seen.
Yeah. Yeah, I think that, it's definitely is helpful. I mean, the Colorado School of Public Health has been kind of a leader in that and saying, we need to look at these issues. I mean, as I said, we also, we say, oh my goodness, burning gas is cleaner than coal, in the Denver area. But how you get that gas is that other problem and things. So I think that that's been helpful and things.
Communication getting to the people who will be living around the areas.
Right. So, through websites, the studies have been, you can go and look up the health impact study at the Garfield County website. So, you can actually read it yourself. So, we've, and the same with the Sacramento research one that they did. It's on their website. It's the St. Mary's Hospital Sacramento Institute in out there in the Western Slope. So, in that way, they've been able to do that so that people who, will read about that and, holding, public meetings and holding, information. That's one of the things like we did very early on in 2008 with the U.S. Geological Society looking at, well, we knew that people had issues and people had questions about fracking, so let's get everybody in the same room and let's talk. And we had actually a fair amount of the commissioners from Garfield County and Mesa County and Delta County, because it was held on the Western Slope, and citizens and people just, we need to come down and talk about these issues. And so, because there needs to be some policy changes in some aspects of it, and like with the worker issues, you need to really be, protecting people tremendously on those areas. So we've been helpful in that respect, I think. So thank you. So
We've gone past the 5 o'clock hour.
Sorry then.
2 announcements. If you've got friends that could not make this talk, Dr. Mulloy is giving the same talk at the Natural History Museum at 7 o'clock this evening. Okay, so you can roust them out and bring them if you would like. Secondly, we have a reception for Dr. Mulloy up in T503. Go back to the elevators, go up to the 5th floor, and take the hallway to the right, and you will find the reception. So, thank you.
Thanks. Thank you. Thank you very much.